Greetings from Dr. Manjunath Shenoy. I'm a dermatologist and a professor and head of dermatology at Yenapoya Medical College, Bangalore. I'm also a coordinator for the National Body of Dermatology, that is IADVL Special Interest Group on Fungal Infection, that is called recalcitrant dermatophytosis. I would like to give a very brief note on some of the fungal infections in human being, especially that affects the skin. The commonest fungal infection that affects the skin is called as the ringworm infection in common language. Of late, it has become a serious health problem in India, probably in the last 1 decade or so. So many patients and families are suffering from this disease, and it causes a great negative impact on the well-being of the patients and family. The patients often resort in India to buying over-the-counter medication from chemists, and they often apply them. And most of the time, these creams contain illogical combinations of antifungal, corticosteroids, antibacterials. And generally, they give an initial relief from symptoms, that is itching and all that. But then later on, it leads to the recurrence of the disease with very severe flares. This problem is far greater than what it appears to be. And let's understand today that it's important we learn certain scientific aspects of ringworm infections and also some tips for the better care. Now, we should understand this fungus is ubiquitous. That means they are found everywhere. So they may be found in plants, they may be found on animal surface, they are found in soil, and also on our skin. Although there are millions of fungi, say about 300 of them actually cause human infections. The fungal infections are highly contagious diseases. They can spread by direct contact or indirect contact. Direct contact in the sense by touching another person with infection or animal with infection, and also by using articles used by an infected person like cloths or towels or so. I'm referring to the skin infections, skin fungal infections. But infections from fungus can also spread through inhalation of the fungal spores also. So many fungal germs can infect the skin. The most common among them is the one what I just referred to as dermatophytosis, which we commonly call as the ringworm infections. These fungi, once they enter the skin, they're capable of growing and invading the outermost layer of the skin, but also they can infect the hair and the nail. Why they do that? They do it because they have to obtain their livelihood. They derive their nutrition by digesting the protein of the skin called as keratin. This was never considered as a major public health problem, but because the infections are highly recalcitrant of late, whenever we give a standard treatment, we expect them to disappear, but that's not happening of late. We need to give very long duration of treatment, and also despite giving such a long treatment, they often recur. So, and often we refer these type of infections as recalcitrant dermatophytosis or recalcitrant ringworm infections. Scientifically or in clinical terms, we call them by various names like tinea corporis, tinea cruris, tinea unguinum, and so on, depending on the body parts that these fungus can infect. The common areas that these infections can affect include the lower part of the trunk, that is, lower part of the tummy, the groin area, the buttock area, underarms, but virtually they can infect any part of the body from head to toe. They can infect even the nails. Generally, once it infects in one area, it slowly spreads to the surrounding skin, but it can also cause infection in the distant part of the skin. So, say for example, to the face, from the tummy area, or to the leg, or to the hand. The amount of itching these infections can cause is highly variable, but by and large, they are generally severe, which can disturb the sleep of the individual and also the daily activities, causing embarrassment, the social embarrassment it can lead to. Apart from these dermatophytosis, which I referred to, the incidence of various other infections across the world is increasing, especially in the environment that we live, that's the tropical weathers. In India, it's presumed that about 1 to 12 cases occur every 1,000 patients. As I mentioned, it can cause any part of the body, infect any part of the body. For example, farmers working in the field can get eye infection once that the fungus containing tips of the wood or straw enters their eye. Fungus can also invade deeper organs like lungs and brain. The dermatophytosis, which I referred, it generally does not cause such serious illnesses, but it is capable of causing serious impact on the well-being of the individual because of the disfigurement that causes due to discoloration of the skin, and also because of the intense itching that they can produce. Now, I mentioned about the climate factor, which is important in causing the disease, which we cannot modify, but there are certain other risks. For example, the poor personal hygiene, excessive sweating, sharing of dresses and towels or articles from others, exposure to contaminated surfaces like shower facilities, swimming pools, and so on, taking part in activities that involve frequent skin-to-skin contact, wearing tight-fitting innerwears, jeans, and other pants, obesity, internal diseases, malnutrition in children, weakened immune system, for example, in people with the HIV/AIDS disease, or those who are on cancer chemotherapy or steroidal drugs, using over-the-counter creams that usually contain, as I mentioned, the corticosteroids as one of the ingredients. And finally, faulty treatment or inadequate advices given by the physicians. And often patients resort to stopping the drug prematurely, which can cause initial improvement and worsen once again for worsening of the disease. Skin fungus can cause a negative impact on psychosocial and occupational health of an individual, compromising the quality of life. India shares a huge burden of fungal infection, especially in the recent time, that of the skin infection, especially the ringworm infections. In India, we need a robust reporting system and improved facilities for rapid diagnosis and improved treatment strategies as well. Dermatologists across India are warned of the epidemic of ringworm infection, and that is resistant to the standard treatment regimes. The bigger concern has been the misuse of topical corticosteroids, especially over-the-counter creams, which are generally harmful and can render these infections resilient. The largest representative body of dermatologists, that is Indian Association of Dermatologists, Venereologists, and Nephrologists, known as IADVL, has brought up a task force initially, and now we have what is called special interest group to address this problem of recalcitrant dermatophytosis. A number of activities are taken to educate the healthcare professional, and also to bring awareness among the public by various activities. A consensus has also been brought to address the management of correct scenario of fungal infection, which can be useful to all physicians, which is published. It is important for all healthcare professionals to be aware of this fungal menace prevailing in India. It is a duty of everyone to manage these infections adequately, utilizing the consensus guidelines which we have published, and counsel the patient adequately so that this epidemic can be controlled. The patients with the ringworm should stick to the advice of the doctors and complete the course of treatment. In case there is inadequate response, dermatologist advice should always be taken, because these are the specialists. Dermatologists are the specialists who know a little more about these infections and probably could give better advices. It is imperative that one should never resort to the OTC cream application, because although it is an alternative medical advice, but it's not going to help either. So with this, some of these words, which I believe is useful as tips to the management of the commonly prevailing skin infection, that is dermatophytosis or ringworm. I thank you all for patient listening.